Assalamu alaikum. Good morning. Khushamdeed ji ayanu. Goeiemorgen.
Thank you very much, ladies and gentlemen, for tuning into PTV World. You're watching World This Morning alongside the very fantastic, the very superb, the very amazing Shiza Hashmi and Shahzad Azher Karam.
Shahzad, today happens to be 24th of March, and we are observing International Tuberculosis Day along with so many other member states of the UN today.
Exactly, and I will give you a brief background as well. But before moving on towards the brief background, since you mentioned that there was this uncle of yours, who was coughing as well. And not just that, I've witnessed it with my own eyes as well. That there was this lady who actually took his son's rishta, to another house, and then while having a conversation, she told them that while he was growing up, he had tuberculosis, but he recovered 100% and whatnot, and they refused to actually give them a rishta as well. So this is very sad. And I think that there's a lot of awareness which needs to be spread, even though that this is a disease which you can be cured of 100%, alhamdulillah. But not just that, I think getting into the background, it was back in 1882 on the 24th of March, the same day, when Dr. Robert actually found the bacterium as well. And that was the time when we realized that, okay, that things can get better. Because other than that, tuberculosis, Shiza, was one of the most fatal diseases as well, and people would succumb to this disease and die, and almost 4,000 people would die every year, tuberculosis. And since 2000 onwards, more than, I think you know the figure too, 63 million people
have been saved, definitely. I think this was only since 2000 onward that there was it was one of the missions of course, all the UN member states as well to eradicate it. Unfortunately, Shahzad, Pakistan is one of those countries which is majorly hit by this epidemic, I want to say as well. So many millions of lives actually are definitely altered by it, affected by it, and then sometimes even, well, given up to it as well. And speaking, so sorry Shahzad, I'm cutting you as well, but since you spoke about tuberculosis and its persistence for so many years as well, I want to really learn if it has something to do with the area you live in or the age group you're in. So many questions, and I have even we've been getting questions from some of our viewers as well that they want to ask the doctors too. So we'll do that. But the good thing is, the theme for this year is the clock is ticking, and I think this theme actually sits well for so many scenarios that we are going through since last year as a global community, right? Of course, there's a pandemic, then there's this particular epidemic, and this being the second most common disease, bacterial disease actually, which is the cause of death. Can you believe that?
Exactly, that's true, Shiza. And this is very sad, unfortunately, that over in Pakistan, we are amongst those two countries where polio still exists. So I think that one way or the other, within the sector of healthcare, we need to do a lot of work. We need to bring together people. We need to come together with the same agenda. Just a few days ago, you remember that we had doctors from Turkey and Pakistan who were joining hands as well. I think we need such collaborations to make sure that the standards of medicine over here in Pakistan kind of goes up as well. Everybody knows that we have good doctors. Pakistan is home to good doctors and home to producing good doctors. But the healthcare system, one way or the other, imagine that, in 2021, we're still combating polio, we're still talking about tuberculosis, ladies and gentlemen. There's a lot which needs to be done, but without any further ado, I think let's get a better understanding of what tuberculosis is, and then let's ask about the treatments available, early diagnosis. I think these things will help everybody who's out there. And please make sure, if even if somebody's coughing too loud or too hard, don't tell them that they might have tuberculosis. Let them go figure out themselves as well. So without any further ado, ladies and gentlemen, we are lucky that we have been, on this very important day, we have been joined by public health specialist. He happens to be Dr. Ghulam Nabi Kazi Sahab. Hello, sir. Assalamu alaikum. Good morning.
Assalamu and good morning to you.
So thank you very much for joining us. It's wonderful to have you.
No, it's nice of you to have us.
It's our pleasure.
Likewise, brilliant, brilliant. I like the amazing comment you've just made. I like such comments. But alongside Dr. Ghulam Nabi, we're lucky that we've actually been joined by another public health expert, and she happens to be Kinz Eman. Hello, assalamu alaikum. Good morning.
Good morning. Thank you for having us on the show.
Thank you very much for joining us. It's wonderful to have you. But there's one question on a very lighter note. It feels like, when usually I sleep at night, I wrap something around me and, my face is not really visible. And I feel a little sleepy, and that's the time when I go to sleep. Are you sleepy?
No, I stay awake with this thing.
Well, that's
I
wonderful.
sleep the other way.
Yeah, and I mentioned before that, no offense, on a very lighter note. Okay, so last but not the least, ladies and gentlemen, we have a development expert with us as well. who's wearing a wonderful jacket and he looks amazing. He is Dr. Azher Karam. Shah Sahab. Hello, sir. Assalamu alaikum. Good morning.
Walaikum assalam. Good morning.
How are you, sir? Thank you very
fine,
much for joining us.
I'm perfect.
Wonderful to have you. So let's get the conversation started with Dr. Ghulam. So, sir, you really need to tell me, my co-host, my entire team, and the audiences in 46 different countries what tuberculosis is, and what causes tuberculosis, and where is Pakistan in terms of this infectious disease.
Good. That's quite a tall order, but you made my life easy by mentioning a lot of things.
Yeah.
Okay.
Now, when Dr. Robert Koch identified Mycobacterium tuberculosis in 1882, that's like 139 years ago.
Yeah.
He could not have imagined that today in 2021, TB will still be the largest killer in infectious diseases,
Largest killer in infectious diseases.
killing 4,000 people per day
Wow.
and affecting 10 million new cases
Right.
every year. And in Pakistan, we have not been too lucky. We are number 5th on the high burden list of
We're number
22.
5th.
Number 5 on the list of high burden countries,
Okay.
which means we're getting about 600,000 people, new cases every year, which add to the prevalent pool,
Okay.
and the people go on spreading infection. Now, what is happening is that
So can you please
I beg
explain
your
to us,
pardon. Sorry.
yeah, no problem at all. If you can kindly explain to us the biological science behind how the bacterium might affect your body and why it causes that disease.
yeah, essentially it affects the lungs,
Okay.
but it could affect any part of the body.
Oh, okay.
But the disease which is infectious is the one which affects the lungs.
Okay.
So we pay more importance to that, although childhood TB and other TB, extrapulmonary TBs,
Right.
they're also very important for TB control.
Okay.
And now that we have had international commitments and agreements, and
Yes.
we are pledged to eliminate TB by 2030 or 2035. Let me just say 2030 right now, because it's still 9 years
Yeah.
away, and we could do it. And the point is, we are not in good shape, because the program started about 20 years ago,
21
in 2000, 2001.
Yeah.
Yeah.
For one first decade, we set up DOTS facilities, this directly observed treatment short course
Okay.
at that time.
Okay.
And we improved the coverage across the country, all over Pakistan,
Yeah.
by 2005. After that, we steadily improved and improved and improved till 2010 or 11.
Yeah.
And then we sort of plateaued off
Okay.
in terms of case finding, in terms of identifying new cases.
Okay.
And then in the last 2 years, we
But that
actually,
doesn't mean there were no new cases, right? There were still new
the
cases.
cases were there,
Okay.
but they were not identified,
Okay,
which
okay.
is very risky, because if you don't treat the cases, they will be infecting others,
Yeah.
and we will not know who they are.
Okay.
And they'll be in the communities, and they'll be infecting about 10 to 15 others over the course of 10 years.
Okay.
So our main priority is always to identify cases
Okay.
and treat them and cure them.
Brilliant.
And
Dr.
the
Saab,
course is around, on average, 6 months.
okay, the treatment
So-
course you're talking
So
about.
there's no need for stigma.
Yeah,
It
of course,
is
of course.
highly curable in the majority of cases. And those who are resistant to first-line drugs, even now the short course has been come down to 9 to 11 months. Kinz.
Yeah.
So really we're in good shape over there.
Okay.
The problem is we're not finding enough cases.
Exactly. So what, ladies and gentlemen, Dr. Saab is trying to say is that, that it's really hard to figure out, that where all those people are who've actually been infected by tuberculosis as well. But let me move on to Kinz over here, because, there is a stigma. Even if Dr. Saab says that, we really do not need to be stigmatized with this kind of conversation, I think that, there is stigma because it is an infectious disease. The person needs to be by himself. He
Right.
cannot share the, cutlery or all of those things which he uses by himself as well. So we really need to put a check on that as well, whether is that true or not? Or do we really need to wear a mask, and can we protect ourselves if you're looking after somebody who's actually got tuberculosis? Because this is something which we have seen during the pandemic.
Yeah.
That, you know, you wear a mask and that you are safe and that the infectious disease is not going to get to you. So let us know that, you know, why is it stigmatized in the first place? And then number two, that, okay, you know, God forbid, if you have somebody who's got tuberculosis at home and you are to look after them, what should you do?
So if we talk about like what in my assumption, like for now, we are isolating the people who are getting COVID.
Yeah.
Years back, because people used to die because there wasn't any treatment, so the people with TB were actually isolated in the sanatoriums.
Okay.
The same scenario, that if TB comes in one house, everyone from that house dies.
Yeah.
That particular primitive thought is actually building up till date.
Which is not true?
Which is not true.
Okay.
Which obviously not true.
Okay.
Like initially the bacteria is infectious.
Okay.
It can be communicated from one person to another. But while you're taking treatment, after I think after a month or so, it's not infectious anymore.
Got it.
So in the initial month, the person needs to wear a mask, but there is no need for isolating
The
them.
person who's got tuberculosis needs to wear a mask.
Needs to wear masks for the initial month of his treatment.
Okay.
The treatment needs to be continued. The treatment cannot be stopped for even a single day. It has to be taken continuously for 6 months for normal tuberculosis. But there is no need for stigmatizing the persons.
Of course.
Now we have a preventive therapy available. It's called IPT. It's available, and the person under 5-year-old in that particular house are actually recommended to be placed on the prevention therapy.
Okay.
And there is no need for stigmatizing it anymore. We hear stories about women being stigmatized, even the relationships being broken down because of contacting TB. But we need to, even in the current times of COVID, we don't need to kind of start hating somebody for having the disease.
Of course.
And tuberculosis is 100% curable at the moment.
But also, Kinz, how is it transferable? Is it through droplets? Is it airborne? If anything?
It's transmitted in the same way
As COVID is?
but it's not as contagious as
Got it.
COVID.
Got it.
And then we know the stains now and
Yeah,
everything
yeah.
because of the advancement in diagnosis and everything. So it's not requiring stigmatization. Yeah, if a person in your house has TB, it's good if you go for the like the other households get the prevention therapy.
That's great.
And that's fabulous as well. But let me move on to Azher Saab over here very quickly, because, you know, I think it's for everybody out there, since we are raising awareness about this disease itself. I think what we really need to do is we need to talk about how can somebody self-diagnose that, God forbid, you know, I might have tuberculosis. I think that's something which we need to talk about. So what are the early symptoms anyone would feel, you know, which will differentiate from a normal cough to a TB cough?
Thank you. Usually, as per WHO criteria, the person who have cough more than 2 weeks is a presumptive TB case.
Okay.
You have to go and
Even if you're a smoker, non-smoker, you know,
if you're a
things like
smoker,
that.
non-smoker. And nowadays, there are a lot of technology development in all areas. Same is the case with in TB diagnosis. Few years back, there were only simple X-rays. The big X-rays you were supposed to go to the hospital and have
the lungs X-ray?
Lungs X-ray. But nowadays, in 2021, we have digital small X-ray, Fuji X-rays, which is handheld, portable. You can take it anywhere with artificial intelligence.
Okay.
You don't even need a doctor to diagnose.
What do we mean by artificial intelligence and X-rays?
Yes, artificial intelligence means it's an artificial with computer setup. Like you will.
So, okay, so you do my X-ray, God forbid,
Yes.
if I have tuberculosis, the computer is going to detect it itself.
Yes, it's
that, okay,
simply-
tuberculosis.
there's a scoring.
Can you rely on that computer? Because
Yes.
otherwise I'll have to go through an entire course in 6 months.
This is the this is the pilot. We are doing it.
Okay, this is a pilot. Okay.
Yeah,
So
first
it's
time in
not that
Pakistan.
trustworthy as of now.
First time in Pakistan.
Okay,
It
that's
was never before in Pakistan. We are like pilot project. We are testing it.
Yes.
And same people used to go to the microscopy for sputum testing, because that is the final test which you do for TB.
Okay.
Otherwise, no test is authentic.
Okay.
Except then your sputum
Okay.
for tuberculosis.
Okay.
Some doctor can diagnose TB by seeing your X-ray if you're not sputum producing. But if the TB patient is producing sputum, you have to go and you have to test it on the gene expert machine, which is very authentic, rather than going to the sputum.
Other than the artificial intelligence.
Yeah.
But that is brilliant, but you know,
Is there something to share? Yeah.
yes, please.
So the artificial intelligence thing is also not that unreliable.
Okay.
What's happening is there are a lot of the advanced solutions coming up, which are giving comprehensive assessment of the lungs, whether you have pneumothorax, whether you have atelectasis, any kind of disease that is happening that earlier used to like kind of go to the huge genetic X-rays, and then the radiologist used to take notes of that and then mark that.
Go to a pulmonologist, probably get them checked.
Yeah, and then what is happening now is there's certain artificial intelligence softwares available which you run the X-ray, which directly runs into the system and provide you a comprehensive report on in between 10 to 21 indicators. That provides you a comprehensive assessment of your lungs, and the diagnostic accuracy of the X-rays and the artificial intelligence softwares is reaching up to 98% these days.
Okay, that's good. But you know, it's really good to hear about these technologies coming in, and now easier testing, probably easier results, but it's still 2021. And like Dr. Saab mentioned, it's been so many years. I really don't understand. So my question, being a layman, is maybe in the near future, do we see a time where this bacterium does not affect us anymore? Does it have something to do with our immunity? Can that happen, first of all? And secondly, you guys spoke about international commitment towards eradicating tuberculosis as well. Well, of course, it is a part of the SDGs by 2030, but there's also a mission for 2022. Can one of you shed the light on it?
So, going backwards from this question, Pakistan is a signatory of the UNHLM declaration, where there was a high-level meeting convened, and every country, all the member states, had certain targets for 2022. We almost need to reach 2.2 million people with tuberculosis till 2022.
Yeah.
How many have we reached so far?
Unfortunately, because of the pandemic, we are in the last year, we have got our TB annual case notification 17% below what it was in 2019. Let alone our commitments and the targets.
That's a good news.
No,
right?
it's not a good news.
It's not a good
17% low in terms of.
So we have an incidence somewhere around 560,000 cases. If we are not finding any cases, they're staying there, spreading the disease further.
So there are more people who have TB. That's what you're saying. So I thought that we are probably coming down in the numbers.
No. So we were unable to actually reach out to 17%. We were able to reach to 17% less people as we did in 2019.
Yeah, but that's what I'm saying, that it might be because of the fact that people don't know that they have TB.
Exactly.
But that's the bad thing, right? Because they're still spreading.
So what should we do about it?
Wrong interventions at the wrong time, and how to sort of cure TB without getting to the wrong parts of it.
Actually, we evolved over time, and now we are at quite an advanced stage. As Kinz was mentioning, there was a time when people went to hill stations or sanatoriums. That time is gone.
Yeah.
I mean, it may be interesting for you that the Quaid-e-Azam, he inaugurated the State Bank of Pakistan on the 1st of July, 1948.
Yeah.
After that, due to his complete privacy, nobody knew where he was.
That he had tuberculosis, right?
And on the 22nd of July, the Secretary General of the Cabinet Division, Chaudhry Muhammad Ali Sahab, he called Colonel Laibaksh, who was a physician, and told him to report to Ziyarat. He said, who's the patient? He said, the Quaid-e-Azam. So that was the level of progress we had made till then. But I must mention that even before chemotherapy, Europe had cured itself of tuberculosis by a few simple habits.
Share those habits, sir, please.
I mean, you don't have to go for overcrowding, you have to eat clean things, you have to avoid infections of all sorts. So really, before chemotherapy came in, Europe had cured itself. Pakistan got the first consignment of streptomycin through Ambassador Isfahani for the Quaid-e-Azam. Somewhere in September.
So I'm just a little confused since you mentioned about chemotherapy. Is chemotherapy one of the treatments for tuberculosis as well?
By chemotherapy, I mean treatment.
But so chemotherapy is actually a tuberculosis treatment as well. I never knew that. I thought that was only for cancer patients.
No, it's a general term. It's for all.
Okay.
So really, and the therapy used to be quite long. Okay. I'll just call it therapy. The therapy used to be quite long, actually, 1.5 years. We brought it down to 6 months, from 8 months to 6 months. So it's highly curable, and it's easily diagnosable, like Shah was telling you. All you have to do is take a portable camera, which will take your chest X-ray, link it with artificial intelligence. In 30 seconds, it tells you what's the degree of
disease.
Disease.
Or intensity.
And then you get a confirmatory test, and that's it. You know either way, whether you have it or you don't.
Yeah.
So really, we have made a lot of advances. The thing is to get the advances to the public, to the people who need them most, to the most inaccessible peripheral populations.
So just one simple question I need to ask. Okay, so we truly get what you're trying to share with our audiences, and we hope that the audiences out there are understanding as well. God forbid that if via artificial intelligence we've figured out wrongly that somebody wasn't really having tuberculosis, but the artificial intelligence, one way or the other, I know that it must be very accurate, kind of diagnosed a person wrongly, and if he or she is on the treatment already, do you think that it can have other impact, other, God forbid, it can lead you to another disease because you really didn't have TB, you were on the course because, artificial intelligence kind of diagnosed you of that, and then you started the course. So are there going to be any repercussions of that course
I think the question
on somebody who really did have TB?
I think you should not start treatment simply on that basis.
Of course.
Because we have to follow the national TB guidelines. It is not there.
Sir, ये एक आम फहम सवाल है मेरा.
बिल्कुल सही कहा.
गलती हो जाए.
You're absolutely right. So we do not start treatment.
Yeah, we cannot start treatment without any confirmatory tests, and then even after, if the person is not sputum producing, they're going for clinical diagnosis, of course. But yeah, without having the disease, like for example, if I am having the disease, people at my home cannot start taking medicine. Or maybe if I'm having cough more than 2 weeks, I just sort of presume that I have TB and I start taking medicines.
So
like it's obviously it's antibiotics, and you're going to take antibiotics for 6 months, a combination of antibiotics. You cannot anyway start. And obviously, if you take medicine, any medicine, without having the disease, it all obviously will have side effects. But if you are, once you're diagnosed, you can take a regimen that has been defined in the national guidelines that is based on the international standards for 6 months for the drug-sensitive TB and for about 9 months for the drug-resistant TB. Because we also have a drug-resistant strain, we also are getting certain cases of extreme drug resistance who are resistant to more than 3 or 4 this drug combinations. So we need to, there are other regimens that are applied for kind of treating those cases.
Okay, thank you so much for saying that, Kinza, and if we have time, we'll definitely get back to that. But moving on to Azher Saab, I think one of the very important things we missed out on, where Dr. Saab said that Europe got rid of TB so long ago. So there must be, I mean, demographics must be a factor. Economy or probably lifestyle must be a factor. Is gender a factor? Is age a factor? Let us know everything, please.
I think gender doesn't affect it.
Okay.
Like male, female, it doesn't matter. But nowadays, like there are some intervention which we called active TB finding. Active case finding. Usually people were supposed to come to the hospital for their checkup, but now in Pakistan we have a lot of interventions going on. We go to the people, to the key population, like coal miners, like transgenders, like these people which are living together in extreme conditions.
So you categorize them as the key target population because of the conditions they live in.
Yes.
That makes sense.
So there are some interventions going on. Like we are looking after, like we have to find TB.
Of course.
And we have to treat them,
God forbid,
rather than waiting for the patient to come and check themselves.
Exactly, that's wonderful, and I think that should be the message with which we really need to wrap up the show as well. But sir, thank you very much, ma'am. Thank you very much for joining us. It was wonderful to be in conversation. And that too on such an important day where we really need to step outside and find those people who might have TB. So I think it has a lot of confusion in itself as well, but best of luck to you guys as well. And I think you really need to, you really need to be praised for the kind of services you guys are, providing to all of those people who belong to that segment of the society in the first place, and then really might not be able to kind of finance their treatments as well. So thank you very much for joining us. Wonderful to have you. And for everybody who's out there, ladies and gentlemen, we know that we really do not come across a lot of people, and it's just because of the medium of communication. But for everybody who's out there who watch our show, because we know we are getting heard, alhamdulillah, the kind of feedback we get or the kind of clips we get back in our WhatsApp group, I think tells us that there are a lot of people watching us. It's your responsibility to kind of let everybody know. I think it's a collective and a shared responsibility which we really need to fulfill with 100% of our heart.
Absolutely, Shahzad, thank you so much for saying that. And I feel like where the amazing panel of guests over here mentioned that there are so many, probably even millions of cases not reported. I feel like people who do have tuberculosis without being diagnosed, they might have a hint of what they have, but because of the stigma that we talked about, or because of the fear of what the treatment will be, or if they will come out safe of the treatment, if they will make it or not, I think there are just so many question marks with it that people are really scared to go get tested. It is totally all right. You will be definitely accepted in the society, and for all of those people who have to accept people with tuberculosis, be kind, be compassionate. I mean, really, it's not that dangerous anymore. It's 2021. They will get over it, but you have to get over it first. Be helpful.
Exactly.
One thing we really couldn't talk about because we're short on time is the pandemic, and I feel like people who already have tuberculosis and then contract COVID-19 as well, it's really hard for them as well. Maybe we'll have another segment about it to talk in detail. Until then, ladies and gentlemen, if you have any questions, any feedback, or any suggestions even about this particular topic or any other, do let us know on our